So we'll begin. So good evening and welcome to the Colorado Council of Black Nurses 2021 Scholarship Soiree, Setting Up for Success. My name is Kelsey Boyard, and I am the chairperson of the scholarship program. I have the great pleasure of introducing you to our new and catching you up on what our current scholars have been accomplishing. Success just isn't about what one can accomplish in life. It's about what you can inspire others to do. Our scholarship program looks to provide that inspiration to future nurses. At this time, I would like to introduce the current president of the Colorado Council of Black Nurses, Robin Bruce.
Good evening, everyone. Hope everyone is doing well today. I want to thank you all so much for coming out on behalf of the Colorado Council of Black Nurses Incorporated in support of our CCBN scholars. We have a wonderful program for you. Just want to tell you a little bit about our scholars and the people that you are supporting. On average, about 90% of our students are self-paid, meaning that they hold full-time or part-time jobs while going to school. On average, 85% of our students care for someone other than themselves, whether that's children, aging parents, or chronically ill loved ones. 100%, well, let's say about 99% in case I forgot somebody, are commuter students, meaning that they do not live on campus and must travel to class via public or private transportation and the costs associated with maintaining that transportation. Many of our students are put in the position of choosing between working full-time to feed their families, leaving them ineligible for financial aid, or working part-time to qualify for financial aid, resulting in dire living situations. An unacceptable amount of our students who qualify for merit scholarships are not even told about them and instead are encouraged to apply for need-based scholarships they know they will not qualify for, leaving them short on resources to even cover tuition and books, let alone additional nursing school fees like test, exam fees, uniforms, and equipment costs. These are just a few examples of how the needs of our scholars may differ from the average college student. While many students scrape enough funds together to meet the demands of tuition costs, there is little to no funds left to cover books, transportation, food, nursing supplies, or other needs that can impact a student from successfully staying enrolled in college once they're in, or nursing school and make it to graduation day. The scholarships offered by the Colorado Council of Black Nurses Incorporated recognizes non-traditional barriers to matriculation and successful graduation rates of the students' populations we serve. Of course, donation of funds go a long way to help ends meet for our scholars, and we appreciate where and when you're able to give. Money, however, is not the only way you can support a student. Just showing up today is a huge support that gives them confidence in what they are doing and that their struggles and efforts are valued. But other ways that you can support is suggesting viable jobs, equipment donations, sponsorships of students. There's just a myriad of ways, and you can go on the website at eccbn.org under donations to see all the different ways that you can give to our students. And with that said, I'm going to turn it back over to Kelsey. Again, on the behalf of the Colorado Council of Black Nurses, I'm President Robin Bruce, and I thank you all for your support today. You're muted if you're saying anything, Kelsey.
Thank you. So I would like to again thank Robin for that beautiful welcome. And this is the agenda we have for today. So we started with our welcome and our president welcome. We will discuss the history of success, current success of the organization, continuing success, Our wonderful speaker, Mia Evans, will talk about her success. We will have a little fun little Kahoot. We will have a presentation by two of our current scholars about mentoring for success. Oops. Then we will have our 2021 scholarship recipients and our current scholar introductions. We will do another Kahoot. We will talk about our future success, and we will have our closing. The Colorado Council of Black Nurses has been awarding scholarships for 47 years to individuals pursuing the nursing profession, with its first scholarship awarded in 1974 to encourage Black nurses to attain higher education in nursing. The first scholarship was $100 per year, which was a big deal back then. The first two scholarship recipients were Maxine Johnson and Mary Lou Watson. CCBN's first scholarship luncheon was held across the street from the Colorado Women's College, which is now Johnson & Wales University, at the University of Denver's Houston Fine Arts Center, which is now the Denver School of Arts in Park Hill. And here's a few pictures of some of our past and current nurses celebrating in their success. For our current success, we would like to thank the foresight of past President Ellery Archer in applying for the COSI grant 6 years ago. The CCBN scholarship program is now able to award tens of thousands of dollars in scholarships, a far cry from the $100 per year that was given back in 1974. The Colorado Opportunity Scholarship Initiative matches dollar for dollar select funds raised for scholarship recipients. These are a few activities that some of our current scholars have been able to participate in. For continuing success, CCBN program offers more than financial support. We offer our CCBN scholars mentors for the purpose of receiving support services to meet matriculation, graduation, and employment goals. We focus on community involvement and global awareness for the purpose of providing real-life nursing experience while improving healthcare opportunities for underserved populations and providing fresh insight on improvement opportunities for the nursing profession. CCBN scholars are taking on more active leadership roles as administrators of individual service to community projects, laying a foundation for further project development into sustainable programs after graduation, and learning higher level skills that prepare the scholars for graduate school. And we will have an example of that when our scholars present Mentoring for Success. CCBN scholars are also afforded the opportunity to take on leadership positions within the organization. As we continue on our journey of setting up for success, I have the pleasure this evening in welcoming a true vision of success, Mia Evans. The field of nursing has provided Mia Evans with so many wonderful and career challenging opportunities in the last 18 years. She began her nursing career as a certified nursing aide, continued her journey, and attended the Community College of Denver nursing program, where she became a licensed practical nurse and soon after received her associate's degree in nursing. She worked as a bedside RN and charge RN in the NICU for several years and decided to take her career further to become a neonatal nurse practitioner. She graduated from Regis University in May of 2015, as has been blessed with several great opportunities, including working for Children's Hospital Colorado in their Level 4 NICU. Her next goal is to complete the Doctor of the Nursing program at Regis University by 2025. At this time, I would like to welcome Mia Evans.
Hello. Can you guys hear me okay? I hope so.
Yes, I can.
Okay, great. If you hear a random 2-year-old screaming in the background, he belongs to me and I apologize in advance. I'm trying to keep him away, but we'll see how that goes. Thank you so much. Janae reached out to me a couple weeks ago to see if I could speak today on visions of success. It's so hard, talking about yourself, but I'm happy to share my journey with everyone. So I thank you guys so much. I'm no longer in Colorado. We moved to Dallas a little over a year ago. So I am super remote, but I'm just happy to be here this evening. So I'll get into it. My journey began, like the introduction said, I was, I graduated from college, or I'm sorry, from high school, and I knew that I wanted to go to college and I knew I wanted to go into nursing. I thought I wanted to be a labor and delivery nurse. However, after watching my niece be born when I was 17 years old, and so I was like, I want to do that. I want to go into nursing. And I had gotten a scholarship from Colorado State University. And so I said, well, I could do pre-nursing there and then kind of move on from there. So in 2003, after I completed my my pre-nursing, basically, it wasn't a degree, but it was the prerequisites, I guess is what I'm trying to say. I went ahead and I said, nursing is still my goal. I applied for University of Colorado as well as University of Northern Colorado. And at that time, it was, thousands of applicants and only a certain amount of spots. So I was very discouraged that I didn't get into either college. But again, all these opportunities that arise, sometimes, we just have to take advantage of those. And so Miss Pia Smith, she started the nursing program at the Community College of Denver, and it was the East Campus. And so I started there. And in the meantime, I went ahead and gotten my CNA license because University of Northern Colorado required you to be a CNA to get into their nursing program. So it just so happens I went ahead and I applied and I, did my CNA at Front Range Community College. And it's amazing that Ellery Archer, she was the past president, but she gave me my first opportunity in nursing as a CNA on the med-surg unit that she worked in. So that was such a blessing that I knew her and she had this job for me. And so that I can continue to work because, as Miss Robin just said, there is, it's really tough sometimes trying to balance, being able to afford life. And at the time I didn't have any kids, so it was just me, but I had an apartment and things like that. But that opportunity that Ellery gave me allowed me to be able to still live on my own. I was able to get like their scholarships that they had, or reimbursement for going to nursing school. So that was such a blessing. So I continued on and I said, I really want to continue to become a nurse. So at the Community College of Denver, as you go through the program, you can sit for your LPN boards before you go on to become an RN. And so I said, okay, I'll do that. And then I was given an opportunity because of my performance during clinicals at Kaiser Permanente. So I started working in OBGYN there. Continued on and I got my RN finally in 2007. It took me a while, but I made it and it was a blessing. So I started working. So again, I had the option of going back maybe to a med-surg unit. And I said, I really wanted to be an L&D nurse. And so again, pulling from, these opportunities I was given, LaVonna Walker, she was the assistant CNO at Denver Health at the time. And she said, hey, the NICU, they're looking to hire new grads. And NICU, I don't know about those little babies. But I went in there and I fell in love from day one. And I continued to work there for several years. And I just felt like something was missing. I knew management was not my calling in life. I know my strengths and I know my weaknesses. And management is not a strength of mine. But I just continued to watch the residents. We started hiring nurse practitioners at the time. And I was like, that's something that I really would like to do. So in the meantime, I had my associate's degree in nursing. And of course, I needed to get my bachelor's degree. So long and behold, I ended up starting the bachelor's program, and the program for the neonatal nurse practitioner program has started that fall. So this is in January. It was starting in fall. And so the director, she said, I'll totally let you in. You have to work your butt off. You're going to have to do your RN to BSN and then get into the master's program. So I kind of was doing dual programs at the same time. Meanwhile, I had just gotten married. I had 2 kids, one of which she was 8 months old, but I was like, this is something that I want to do. I've been putting it off, but now I think I'm ready to go for it. So I went for it. Thank God I didn't think about it too hard, or else I probably would have quit. My village was around me, my mom, my sister-in-law, my brother, all these people were around me, my husband, everybody just kind of kicked in and helped me. So my village, between me and my village, we made it over the threshold. So in 2015, like she said, in 2014, I got my BSN, and then 2015, I graduated, and I got my master's in nursing with emphasis in neonatology. So I've been a neonatal nurse practitioner since then. Working at Children's Hospital it was really eye-opening how many sick babies there are in the families. But it also made me realize that a lot of times families of color, I feel like, have already been labeled, or, people who weren't raised in different socioeconomic backgrounds, they can sometimes have these assumptions that people are a certain kind of way. So I feel like it was me there in neonatology. A lot of times I have been the only person of color or the only Black woman in a unit as far as employees go, and that's Denver Health included. There were some other women of color, but as far as being a Black woman, it was pretty much me and me alone. But I felt like at that point it was my duty, because sometimes the patients, they're in shell shock because whatever's wrong with their baby, it is what it is, but they don't have anybody that looks like them that are talking to them and trying to communicate with them. So, I always feel like a lot of times it was me saying, hey, I'm here. I have your back. If you have questions that you want to pull me to the side and ask, I am here to answer any questions. And it was also me on the other side, letting my coworkers know how we feel about certain kinds of things, because a lot of times they don't know, because they've never been raised around Black people, or, this is their first experience, because a lot of the residents would be young and new to the field of medicine. And so it's a lot, It was a time when I worked at Denver Health in the NICU that I had always gotten really good reviews, and one of the physicians, she gave me a really negative review. And this was right prior to me going into the neonatal nurse practitioner program, and she says that she feels like she knows more than the doctors. These are residents, you guys, coming in fresh from medical school. They don't know anything about a baby. They just know maybe they want to go into pediatric dermatology, or maybe they want to go into pediatric medicine of some sort, but not neonatology, and people don't realize how different babies are. They're not little adults. They are just totally different. The way our systems are set up, it doesn't mature for a very long time. And so I was like, I think I know more than the doctors know. I kind of know more than some of these residents know, because what they tried to do may have ended in a, demise of a baby. So I took that and I built upon it, and I didn't let that discourage me. I said, okay, well then I'm going back to get more education. I'm going back to spend those 2.5 years understanding the pathophysiology, pharmacology, everything that has to do with a neonate. And it's amazing that that same doctor almost ruined my opportunity from getting a position at Children's Hospital Colorado, but the manager said, it's something about you, we want you. So I was able to go back. I felt defeated towards the end of the nurse practitioner program, but, God has a way of turning things around. And he, that manager called me back. They were like, nope, we don't want you to go down the street. We want to take you here at Children's. We want to train you. We've heard so much good stuff about you. So I guess my message to you all is to stay encouraged. We all have, you may have children, you may have other things going on in your life. It's hard to balance work and studying and your education and everything that you have to do, but just continue. If I could do it, I promise you anybody can. Just stay diligent, just stay faithful to your goals. She asked me about, Janae asked me to send over a picture, and I don't know if it's in there, of what success means to me. But, you see the success on the outside, but it took so much work and so many stepstones. There's also another picture I think of where it's what people think, and it's a straight line from your starting point to success, but really is very twisted. It can be, like I said, it took me about 6 years from the time I graduated high school to the time I became an RN, and another 7 years between being an RN and a nurse practitioner. So I just want to encourage you guys to just keep going, and whatever, if anytime you guys have questions or anything like that, the nurses who have come before you, we are great, great, great resources. So you just pull from those resources that you can. Don't burn any bridges, as hard as it is sometimes for you just to bite your tongue. Just don't burn any bridges, because you never know when you'll need to go back or who's watching you that will be at the next place that you're going to. So that is pretty much my presentation. So if you guys have any questions, please feel free to reach out to me. That's it. Thank you.
Thank you, Mia. That's a wonderful story, and it's a great picture to show how when you strive and you work hard and you have a support system behind you, that you can succeed. And by presenting here today, she's reaching back to make sure that others can have that opportunity so we can all move forward together. So continuing on with our program. We have a little Kahoot presentation that our scholars have put together, and I will now turn it over to JL as she will explain to everyone what we're doing.
Hello, everyone. So for this Kahoot that we put together, just have a couple questions. So you can do this on your phones. It'll probably be most easiest on your phone, so then you won't have multiple screens on your computer. But you can look up kahoot.it and just search that kahoot.it, and that website will pop up. And I am going to start. Can everyone see the game pen?
Yes.
I'll give it about 30, 45 more seconds. Does anyone need any more time? Okay, I'm gonna get started here. I believe I'm just gonna take a picture of the game pin, so if anyone is late joining, I can just share that. Okay, so we just have 3 questions. Some of them will require some prior knowledge. That's all I'll say. Okay. Yes, so TCBN was founded in 1973. So we got 2 people who got it correct. Let's see. All right, next question. Oh, okay. May. All right. What year did TCBN award its first scholarship? Pretty good. Yes. Yep. So TCBN was founded in 1973, and in 1974, where first scholarship was awarded. And last one for now. Oh, let's see who moved. Oh, there's Smiley Face in the lead at the moment. Okay. And this one is just a history question. Yes, that was Mary Eliza Mahoney. She was the first Black nurse to legally, or registered nurse to legally practice in the United States. And let's see who got this one. HF. Third, Janae second. Okay, is Kelsey? I'm not sure.
Yeah, that's me.
Okay. Congratulations, Kelsey. Okay. And that is it for now. I am going to go ahead and share my screen.
Thank you so much, JL, for that quick little fun little interlude. We'll get back to our program. And at this time, I have the wonderful opportunity of introducing 2 of our current scholars, and they've come up with a wonderful program for mentoring for success. So I'll turn it over now to Dariana Sanders and Janae Colton.
Okay, can everybody hear me? Everybody hear me? Perfect. So I do apologize. I have a little bit of a cold, so just bear with me. Um, but Janae and I had came up with a peer mentor program to address some of the challenges that we see both with nursing school and pre-nursing. So in nursing school, there's a lot of pressure. Your grades have to be a C is 77 or higher. So you have to have a lot higher grades. You have long lectures. There's a ton of material that's thrown at you all at once. There's a lot of different skills that you have to master. Everything is changing. Your clinicals are one of those things that are constantly changing. You kind of just have to move things around. And then, just balancing your time with life. So if you have to work, if you have, kids or other family members you may be taking care of. And it just creates a lot of stress and just feeling overwhelmed in nursing school. And so then when COVID hit, there was a lot of other challenges thrown our way, such as doing things over Zoom, not having the lab to practice your nursing skills in, and not having the resources to that makes it easier to have academic success outside of just the nursing skills. You can't really bond with your cohort, and you just kind of feel alone, like you're doing this all by yourself. And so then that leads to increased stress levels and anxiety. So then how do we overcome these challenges?
Okay, so does it keep going backward? Okay. So there's 16 studies that demonstrated the mentorship, that 16 studies that showed that mentorship develops communication skills, critical thinking, and confidence, while increasing competence, increased satisfaction, and decreasing anxiety in nursing students, which will all link to academic success. So with that, we will talk about the benefits that mentees, mentors, and CCBN would have. Sorry, have some kids. So if you guys hear background noise, sorry about that. So some of the benefits, is this showing up right on the screen or no?
We see it.
Okay. Okay. So mentees would benefit from this project because they would because this would allow them to have the extra support in nursing school. It would allow them to know how some of the things that they're going through are common and how to successfully get through those trials. What makes this different from mentoring in general is that these mentors are someone who just experienced what you went through within the past 1 to 3 years. A perfect example is just last night, Dariana and I we're speaking. Dariana is currently in nursing school, and I'm on my way to nursing school, and she was able to mentor me by providing me certain supplies and resources so I can become better successful when I enter the nursing program myself. This would benefit mentors because this program would not only mean that mentors are also mentees, but it would also be able, they're now able to pass along some of the great knowledge that they have received and skills to others who are going through what they just went through, as it's still fresh in their mind. And then lastly, this would benefit CCBN itself because the end goal would have all of CCBN networking with each other, and the abundant amount of communication and collaboration between everyone equals success. And so as you can see with all these bullet points, there's an abundant amount of information that can come from just having this program implemented. So now that you've heard some of this abundant information provided on these slides, hopefully you had a quick chance to read through some of these. This would bring us to our next following slides, which would show how early diagnosis equals better outcome, and early implementation equals better success.
Okay, and so the structure that we came up with is, so at the beginning of the diagram there, you see kind of where you start with the pre-nursing or high school students thinking about going to become a nurse. And then once you get into your nursing program, past your prerequisites, your first semester student, second semester, then third and fourth. And then we have our experienced nurses. And so kind of thinking about putting this program into perspective as far as who mentors who, we would be looking at the experienced mentors mentoring the third and fourth semester students. The third semester students would be able to mentor the first semester students, while the second semester, fourth semester would be mentoring second semester students. And then second semester students would be mentoring pre-nursing students, as well as those high school students that are looking into going into becoming a nurse. So what that may look like is going in and just kind of like setting up meeting to go talk to people who are interested in kind of that career path, and we can answer questions and give a little bit of guidance in that aspect. And then first semester students would also have that opportunity, but we would be first semester of nursing school is rough because you're kind of learning how to balance all of these different things, you know, trying to take a ton of material and, you know, learn a lot of it so that you can build on top of that for each of the following semesters. So instead of having a first semester student paired with somebody to mentor them on a consistent basis, they would have that opportunity to go and volunteer on for some of those one-off type things where we can go talk to a high school student, or maybe we are doing like kind of an information session based on what it's like to be in nursing school. How did you get through it as, you know, a mom or a dad? How did you get through it having to work full time? So that would be the opportunity for the first semester students. And then you kind of see here on the side where the mentees will kind of direct that conversation between that mentee and mentor when they have their one-on-one sessions and work on like, this is what I want to focus on, these are my goals. And the mentor wants to help guide them there. So we're not giving them the answers, we just help to guide them there. And then this also kind of gives mentors the opportunity to implement some of those skills that you learn in nursing school. With assessment, you're continuously assessing the situation, and you also want to, you know, if your assessment is saying that, or your evaluation rather of your actions is we're where we need to be, then you kind of go to that next goal. Or if your evaluation is we're not quite where we need to be, then you come up with another action to help guide your mentee towards getting there. And to kind of keep your mentors on track with your mentees, then we would send out questionnaires to kind of evaluate the program in itself, and just making sure that it's working. And if it's not working, how do we make it work? So yeah. All right. And then some of the potential that we have in collaborating would be the National Student Nurse Association, which is outside of CCBN, rather, is the National Student Nurse Association that gives a lot of opportunities for current nursing students, opportunities to develop as a leader, as well as get involved in some volunteer opportunities and different ways to make an impact in the nursing field. Then the different nursing pathways, which could be like CNA or LPN, working with students in those pathways to help them get to that RN pathway. High school students, again, we were kind of talking about how we can help them get to where they want to be in a more efficient way. And then really just helping within your community, because mentorship is, it is, you're giving your time to help other people get to where they want to be. And so our ultimate goal is we seek to guide and support nursing student mentees and strengthen management, engagement, and communication skills of nursing student mentors in order to facilitate a collaborative learning and development environment on the pathway to success. And so our pillars would be excellence, leadership, community, and personal improvement. Thank you so much for listening to our presentation, and we'll hand it back over to Kelsey.
Thank you, Dariana and Janae, for your hard work and your research. The future looks bright with the hard work and insight of our wonderful scholars. At this time, I would like to introduce our 2021 scholarship recipients. Colorado Council of Black Nurses offers 2 nursing scholarships. The first is the Bernard F. Gibson Senior Nurse Science Scholarship. The Bernard S. Gibson The Bernard S. Gibson Scholarship honors the legacy of CCBN's first chairman of the board, Colorado's first certified Black surgeon, and the first Black surgeon allowed to practice medicine at the University of Colorado in Denver. Bernard F. Gibson belief that the Black nurses as an incomparable asset to the total healthcare delivery system, and his continued commitment to increase the numbers of Black professional nurses in acute and chronic care settings is the inspiration behind CCBN's mission to financially assist, educate, and mentor students with the ultimate goal to place graduates in equitable nursing positions. Students that are in high school, their prerequisites, nursing courses are eligible to apply for the Bernard F. Gibson Nurse Science Scholarship. The next scholarship we offer is the Barbara Toonley Crenshaw Nursing Scholarship. Promoting the advancement of nursing field while investing in the attainment of advanced nursing education, the Barbara Toonley Crenshaw Nursing Scholarship celebrates the extraordinary contributions of Barbara Crenshaw, who was a registered nurse with a bachelor's in science in nursing, a master's in science in nursing, and a professor, of the Front Range Community College to the field of nursing education and is a testament to an invaluable asset that is the Black nurse. This year, we award the Barbara Toonley Nursing Scholarship to Carrie Smith.
Hello, I'm Carrie Smith, a full of life Colorado native. Although I graduated high school with a full ride scholarship to be a teacher, I had long before since claimed my future and began shaping it in the path of healthcare. I first received my certified nursing assistant, and then I went on to get my certified medical assistant, where I graduated with honors. During my time working as a medical assistant, I learned so much in every environment I was introduced to, from working in the trauma center area of the emergency room to working in the PACU, of the OR, and sometimes filling in the operating room and anything there in between. The more I worked in the healthcare field, the more my desire to do more grew. At the hospital, while watching the staff scram all over the place to provide care for my loved one, to provide the best care for my loved one, I knew then that this was the type of nurse I would be, taking major steps to always provide the best care possible and to always make a difference in others' lives. As a nursing student, I know I bring an exceptionally large amount of experience with me from all areas of the healthcare. And I see myself contributing everything I've learned and compiling with the knowledge together to enhance my role as a nurse, allowing me to grow and succeed in any healthcare setting. Having excellent communication and critical thinking attributes sets me aside from others, allowing me to work independently and effectively, and I would fit it perfectly in any situation. Being a very educated Black woman in today's society is intimidating to many, and to take this to a setting where many have been taught to notice color first and your heart and smarts last makes it difficult for many people of color, regardless of their role. I have learned from my past experience to gain trust with my patients and to continue to be the best one who stands out, providing exceptional care. For this reason, I want to be a nurse. I would like to thank the Colorado Council of Black Nurses Incorporated for awarding me with the Barbara Toonley, Crenshaw Nursing Scholarship. This scholarship will help me financially to allow me to work part-time and focus more on school and be able to excel and finish strong in the BSN program and achieve my lifelong goal.
Thank you, Carrie, and congratulations. And we look forward to working with you in our program.
Thank you.
Next, we have our current scholars. Our first scholar is Yvonne Ezzy.
Hello, my name is Yvonne Izzy. I'm currently a nursing student and would like to thank CCBN and its donor for the financial support to pay for college and supplies. I also would like to thank CCBN for the mentorship for many outstanding knowledgeable nurses. I'm one step closer to my dreams. Being a CCBN member helped me connect with awesome people in the healthcare field, within the organization, and with outside of the organization. CCBN has helped me with deciding the area of nursing that I would love to pursue, as well as encouraged me to further my education and not stopping with just a bachelor's in science and nursing. I recently did a nursing project in the area of mental health involving African Americans and minority students, which has persuaded me. Excuse me for a second. Which has persuaded me my area in mental health field to provide the awareness and recognition to others like me of what mental health looks like. Being a part of CCBN, I have gained so much wealth and knowledge that I'm able to pass on to the community as well as other current nursing students. I am a part of something that is much bigger than me, and I'm happy that I can be able to contribute. I currently have not had any issues negatively that impacted healthcare, but I do know if I ever encountered any issues that I can always come to CCBN to help me navigate through it. I thank CCBN for being here for those like me and others as a place I can call home, mentorship, and I'm glad I can be a part of the change that I wish the world to see. I currently also work with the CCBN, posting jobs to the website, as well as being able to help organize a career fair with an HR representative outside of CCBN. So I'm glad that I can be a part of something and be able to contribute. So thank you, CCBN, and also the donors to be able to provide this opportunity for me and others.
Thank you, Yvonne. Our next scholar up is Dariana Sanders.
Again, my voice is I'm sick, so I'm gonna keep mine short, but I really just want to say thank you so much to CCBN and everything that it has provided me from helping me to be able to really focus on my studies and work kind of as I want to, just for that nursing, the nursing skills, because my tuition is fully covered by scholarships to the mentor aspect of CCBN that has been a very integral part to my success today. And I truly appreciate everything that CCBN has done for me as a scholar. Thank you.
Thank you, Dariana. Our next scholar is Danielle Gilbert. I think you're on mute, Danielle. Yes, now we can.
Hello, everyone, and thank you for joining us. Recognizing very accomplished. I am a learning scholar, currently a senior at the Colorado Nursing, and I would love to extend gratitude to the Colorado Council of Black Nurses organization for their mentorship and support. The organization has been an anchor in my journey towards becoming a nurse and just really helping me develop problem-solving skills in my role as a nurse extern. A huge goal of mine has been to, to provide safer care to both women and children of color regarding the birthing process. And the council has aided in that achievement of that goal by allowing me to serve on the Maternal Child Health Morbidity Initiative. And this committee is just devoted to finding ways to improve maternal child health among people of color in our institutions. My scholar project, which Dariana and Janae actually talked about earlier, is also concerning maternal child health morbidity. And that has helped me provide education to my community about the importance of advocating for self to make sure that safe, quality patient care is upheld. Outside of my nursing goals, another goal of mine is to grow the council and the organization by expanding our audience, by appealing to younger generations' interests, and to culminate a more significant population of people of color in healthcare. Again, I just want to thank CCBN for your continued support regarding my education and helping me achieve my goals on both a personal and professional level. Thank you.
Thank you, Danielle. Our next scholar is JL Mallory.
Hello, my name is JL. I am a first-year nursing student in Regis's traditional nursing program. And although I just began nursing school, I already feel at home and really inspired and passionate and inspired by nursing thanks to CCBN. CCBN has given me an expansive amount of community resources and contacts to reach out to, and they have exposed me to so many specialties and fields of nursing that I've never considered before, would have been exposed to before in my traditional nursing program. And because of them, I know fields like aerospace nursing and nursing management. And all that said, I've really been inspired to expand my healthcare education. And I soon hope to pursue, after obtaining my BS, I hope to pursue a certification in holistic nursing and wellness coaching so that I can further provide individualized healthcare to people of color in our community. And I also am really inspired by, or I've been really affected by while attending CCBN's events by the COVID disparities in the Black community, but also other communities who speak other languages, who come from other nationalities and backgrounds, Hispanic, Latinx, etc. So I've been involved with the Global Education Department at Regis, and I've been just really hoping to offer students in the nursing program more education and more involvement in learning cultural competency and language, specifically the Spanish language here in the United States, as the Latinx community has been greatly affected by this pandemic as well. But overall, I just want to thank CCBN and everyone who's invested their time and support into the scholarship program for people like me. So thank you.
Thank you, JL.
Thank you.
Our next scholar is Naomi Alvaro.
Hello, everyone. So I'm gonna just read first what success means to me. So for me, success means accomplishment. It means goal being met. It means being rewarded after giving your all and working hard. Success to me means reaching your ultimate goal and be happy with that goal. Hello again, everyone. My name is Naomi Alvaro. I am a nursing student at Denver College of Nursing, pursuing a bachelor in nursing. CCBN has helped me get through school by offering me their financial, mental, and physical support through mentoring, community outreach, job, and training opportunity. My current goal right now is to graduate from nursing school. The scholarship program is helping me reach that goal by providing resources like mentors, older students, and working nurses that I can use when I have questions or need guidance regarding nursing or just school. My project was to encourage and offer low-cost breast cancer screening within the African community. This project showed me how I can educate and impact my community on how to take care of themselves, especially regarding this disease. I am still in school, so I hope once I become a nurse, I can do more for my community. However, being part of CCBN has given me support and making me feel that I am not alone, as nursing is all about teamwork. Being a CCBN scholar, I have learned to not being afraid of approaching people of my community and talk to them regarding healthcare. It may look like they know, but a lot of them don't know, and they just want someone to take the time to educate them on things regarding healthcare and its benefits. I am very thankful to be part of this organization, and I know that I have full support of the CCBN Scholarship Committee. Thank you, CCBN.
Thank you, Naomi. Our next scholar is Janae Colton.
Can you guys hear me okay?
Yes.
Okay. Hi, everyone. My name is Janae Colton. I am a 2018 scholar and the chair for the Publicity and Social Media Committee for the Council of Colorado, for the Colorado Council of Black Nurses. I am currently a double major in my junior year at Arapahoe Community College, and I am finishing up I'm in my second year of prerequisites for the nursing program, so I can apply for the nursing program in spring of 2022 with hoping to start in fall of 2023. I am currently in the program for my Associates of Applied Science in General Studies as a medical laboratory technician, while I am still pursuing my associate's degree in nursing and bachelor's of science in nursing. I am a wife, a mother of 4 daughters, a wife, a mother of 4 daughters. I also work as a laboratory assistant at Children's Hospital Colorado and a laboratory assistant and certified nurse's assistant at Skyridge Medical Center. Even though my life seems very busy and probably impossible to manage, I'm very grateful for the mentors at CCBN who have taught and are still teaching me how to not only manage my tasks, but not to give up when the tasks seem impossible. The Colorado Council of Black Nurses introduced me to many different fields of classifications of being a nurse, and because of this, my ultimate nursing goal is to obtain my Doctors of Nurse Practice, specializing in pediatric hematology and oncology with a strong background in histology and psychiatry. By participating in CCBN, I was introduced to a teaching position to become a phlebotomy instructor. Even though I wasn't able to secure that position, CCBN has given me the opportunity to teach within the organization to gain the teaching experience needed to become an instructor before I've obtained any degree. With that said, I'm very grateful to be a current member, scholarship awardee, and the chair of CCBN's Publicity and Social Media Committee. My scholarship project for CCBN is to help new moms become educated in pursuing the appropriate healthcare facility for themselves and their families. And since I've started this project, I've assisted in not only educating new moms, but also the community and teaching others why it's so important and beneficial for their families and themselves to go to the appropriate healthcare facility. So with that said, I just want to thank the Colorado Council of Black Nurses and the mentors and the supporters, all of you guys here today, for providing more than one necessary tool needed to ensure my success.
Thank you, Janae. Our next scholar is Janelle Good Smith.
Hi, everyone. I'm going to talk about the next 2 scholar alumni. They will not be with us today. However, their accomplishments bared giving attention to, so I will do that for them. Janelle Good Smith was a 2020 scholar who came to us in the organization just finishing up her LPN and was pursuing her RN when she realized that being an RN was not what she needed to be to achieve what she was trying to get done. So through the mentoring process, we were able to work with her in finding out what's the best route in nursing for her. And since she had her master's in something like, I can never remember what it is, but it's something like hospital administration or something along that line, we took her and helped her utilize her nursing education and apply her master's education to get a viable job that was paying more than, I think she was making $14 an hour. So now she's getting administrative pay, and is no longer in need of our program because she has met all the goals that she was trying to achieve by entering into the RN program. So that was the one way that we were able to help her. Do we have the next slide?
Yes, we do.
Now, Stephanie Dorval Valmont, she came to us and she is pursuing getting her LPN. She's a mom and wife, and there was just a lot going on that was requiring her to make more than she was making. She was pursuing nursing, however, she was working as a waitress. And so through our program and our mentoring, we were able to secure her a job within the healthcare field. We were able to get her a QMAP certification, and she is now gainfully employed at Mental Health Center of Denver. So she's going to take some time off so that she can make enough money to finish pursuing her nursing degree, to finish that LPN. And I believe she's wanting to go into the RN program as well. So she'll probably take a gap year so that she can make enough money to be in a more secure position to get through school. So those are the different ways that we help our students. Sometimes it means that you have to have to hold off of nursing school for a while or take a different route, kind of like Janae is doing. She's taking that MLT course to make more money to be able to fund her education. And thank you.
Our next scholar and alumni is Elsie David.
Hi, everyone. My name is Elsie Peoples. I graduated from Regis University in winter of 2020 with the accelerated program from the Laredo High School of Nursing. And I recently passed the NCLEX, so yay for that. I currently work in the Labor and Delivery Internship New Graduate Residency Program at Rose Medical Center. And had it not been for the scholarship from CCBN, I would not have had the funds to take the NCLEX the second time. I'm thankful to CCBN and all of our funders. Because my specialty isn't immediately available to new grads, it was very important for me to start the Labor and Delivery Internship Residency Program with Rose Medical Center. This residency program focuses on getting new and current nurses introduced to labor and delivery. And because of the Barbara Tinley Crenshaw Scholarship, I was able to retake my NCLEX for a second time and apply for the residency program in time. A major focus of mine is Black maternal health in the U.S. This scholarship brings me one step closer to becoming a certified nurse midwife. I hope to give back to my community by empowering women of color and making them aware of disparities that can impact their lives. CCBN will give me the opportunity to reach more women in my community. One issue in labor and delivery at the moment is that there aren't many Black nurses. Since CCBN gave me the opportunity to be in the room where decisions are being made, I hope to bring about some change about Black maternal health in Colorado and the U.S. To everyone at CCBN, I thank you. Kelsey, thank you for hearing me out and being an amazing mentor. To our funders, thank you so much. Because of you, young women like me can enter the nursing field and impact change in our lives and our communities. Hi, everyone.
Thank you, Elsie.
All right. And so since Elsie is one of our recent graduates and has successfully passed her NCLEX and is officially a nurse, Colorado Council of Black Nurses has a special gift for you. Let me see if we can, So we've gotten you a stethoscope bag to carry all your nursing supplies in. Let me see, there we go. And
Thank you. That's so cute. Thank you. Really appreciate it.
It is our pleasure. Congratulations.
Oh, thank you.
And can all our scholars right now turn on their cameras so we can see the wonderful faces? And once again, congratulate you on your success and wish you well for your future success. At this time right now, we have another little Kahoot that we're going to play. So I'll let JL take over again.
Okay, everyone. Same thing as before. You can go to kahoot.it and when you're ready, you can enter this code. Okay, so this Kahoot will be 3 questions, and it is a little challenging. Not really, but it can be. Here we have 7 people. I'll give it about 15 more seconds. All right. All right, who was Colorado's first Black surgeon? Yes, Bernard F. Gibson. He is one of our scholarships that, or that's one of the scholarships that were, sorry, he's one of the scholarships that are inspired by one of our scholarships. My words. Okay, next question. We have 2 left. Janae is in the lead again. All right, this one's a select all that apply. What factors contribute to Black or African American health disparities? Mhm. Awesome. Yes. Access to health care. There's discrimination, racism, and quality of care. Okay. And that is why our voices in the healthcare system are so needed. All right, so last question. What is the total number of current CCBN scholars? This one is hard. I'm not even sure if I have the right answer, but okay. All right, so that is it. Nay. Third place, Danielle. And our leader or our winner is HF. Okay. And congratulations. HF, I'm not sure who that is. All right.
Thank you, JL, for that fun little Kahoot. Finally, I'd like to talk about the future success. In order to provide our scholars with educational and career opportunities and financial support, we need your help. Located on our website, www.ecbn.org, you can find and scan the QR code for a quick and convenient way to donate to the 2021 annual CCBN Scholarships Foray Fund. Please donate today so we continue to set future nurses up for success. Also, spread the word by letting others know of our scholarship program and our organization. Thank you for your continued support in celebrating CCBN's 47th year of awarding scholarships. Again, thank you for joining us this evening to celebrate the success of our scholars and for your continued support. We look forward to seeing you next year and have a wonderful evening.